What is hippocampal atrophy? Have you ever wondered how trauma can affect our brains, particularly when it comes to memory? Hippocampal atrophy refers to the shrinkage or loss of volume in a key brain structure known as the hippocampus. This area is crucial for forming memories and navigating space. It helps us consolidate new memories and process emotional responses, making it vital for our cognitive and emotional well-being. When we talk about hippocampal atrophy, we are looking at a reduction in the size and number of neurons, as well as their connections within the hippocampus. This change can be detected using imaging techniques like magnetic resonance imaging, or MRI. In these scans, the hippocampus may appear smaller than what is typical for a person's age. Hippocampal atrophy is often seen in various neurological and psychiatric conditions. For instance, it is a hallmark early feature of Alzheimer's disease, where it correlates with the memory impairment that progresses as the disease advances. This atrophy helps distinguish Alzheimer's from normal aging and other types of dementia on MRI scans. Another condition associated with hippocampal atrophy is frontotemporal lobar degeneration. This group includes disorders like frontotemporal dementia and semantic dementia, which show different patterns of atrophy compared to Alzheimer's disease. Vascular diseases, such as subcortical ischemic vascular disease, can also lead to hippocampal atrophy, affecting cognitive performance and daily functioning. Now, let's focus on trauma and post-traumatic stress disorder, or PTSD. Chronic stress and exposure to trauma are linked to reduced hippocampal volume. The hippocampus is sensitive to stress hormones, and prolonged exposure can impair its structure and function. This impairment contributes to difficulties with memory and emotional regulation that are often seen in PTSD. Because the hippocampus is central to memory processing, atrophy in this area can lead to memory deficits, especially in forming new episodic memories. It can also affect spatial memory and navigation. In individuals with PTSD, hippocampal atrophy may explain some of the memory disturbances and challenges in contextualizing traumatic memories, which are core features of this disorder. Detecting hippocampal atrophy is clinically relevant as it can help diagnose and differentiate between various neurological conditions. However, it is important to note that hippocampal atrophy alone is not specific to one disease. It must be interpreted alongside clinical symptoms and other diagnostic tests. From the perspective of PTSD, understanding hippocampal atrophy highlights the biological impact of trauma on brain structures involved in memory and stress regulation. This knowledge supports trauma-focused therapies aimed at improving memory processing and emotional regulation, which are critical for recovery and healing. In summary, hippocampal atrophy is the reduction in size and function of the hippocampus due to neuron loss and decreased connectivity. It is associated with memory impairment and is seen in conditions such as Alzheimer's disease, frontotemporal dementias, vascular diseases, and PTSD. In PTSD, hippocampal atrophy reflects the neurobiological consequences of trauma, affecting memory and emotional processing that are essential for recovery. Always remember, if you have concerns about memory or trauma, consulting a healthcare professional is important for personalized advice and support.